Hello NCLEX students. In this video, we will discuss the most important questions that are frequently asked in the NCLEX exam about prioritization. Stay tuned till the end of the video to grasp all the questions related to priority questions. Before starting the video, we have some urgent news for you. We have launched a 3-month course for you at no cost on this YouTube channel. Over the next 90 days, we'll cover all the essential nursing topics across every subject. Plus, we'll discuss more than 2,000 NCLEX-style questions in our daily live classes. And the best part? It's all completely free. The timing for our daily free live classes will be at 12 p.m. according to New York time. Join our first batch and tune in daily to catch every episode in live class. This is your one-stop destination for all your NCLEX prep needs. No more searching around the internet for NCLEX resources. Stay with us for the next 90 days and let's conquer the NCLEX together. Now, let's get started with today's video. Clients at the family clinic are having their vital signs checked by the nurse who works there. Which patient should the nurse give the highest priority? A. An infant who is 8 months old and has a pulse rate of 148 beats per minute. B. The respiratory rate of a child who is 2 years old and is 28 breaths per minute. C. A pregnant woman who is 24 weeks along and has a blood pressure reading of 144/95 mmHg. D. A man who is 45 years old and has a temperature of 37.8 degrees Celsius, 100.4 degrees Fahrenheit. Choice C is indeed the correct answer. The woman's blood pressure is higher than the typical range for both systolic BP, 90 to 140 mmHg, and diastolic BP, 60 to 85 mmHg. This high blood pressure raises concerns about pregnancy-induced hypertension, PIH, which requires the nurse's immediate attention. High blood pressure during pregnancy can indicate gestational hypertension or preeclampsia, both of which can be risky for both the mother and the baby. Choice A is not correct. The vital signs of this client, an infant, falls within the normal range. Infants aged 1 to 11 months typically have a pulse rate between 100 and 150 beats per minute. Therefore, this client does not require any further attention. Choice B is also incorrect. The vital sign of this client, a toddler, is within the normal range. Toddlers usually have a respiratory rate between 20 and 30 breaths per minute. Therefore, this client does not require any further intervention. Choice D is also incorrect. Although the client may have an infection due to the elevated temperature, it's not as urgent as the pregnant woman with elevated blood pressure. While the nurse should continue to monitor and assess for other symptoms, the immediate priority is the pregnant woman with high blood pressure. Which initial nursing intervention is recommended for a patient experiencing dyspnea? A. Elevating the foot of the bed. B. Removing pillows from under the patient's head. C. Taking the patient's blood pressure. D. Elevating the head of the bed. The correct choice is D. Elevating the head of the bed aids in abdominal organ descent, creating more space for the diaphragm and facilitating lung expansion, which is crucial for a dyspneic patient. This position helps alleviate breathing difficulty by allowing better ventilation. Options B, A, and C are not suitable as the initial nursing action for a dyspneic patient. Removing pillows, option B, and elevating the foot of the bed, option A, restrict expiratory flow and decrease lung elastic recoil, thus not enhancing ventilation. While checking the client's blood pressure, option C is important. The priority lies in positioning the client to alleviate breathlessness and reduce respiratory effort. The nurse has identified several client scenarios requiring assessment. Which of the following situations would warrant immediate attention from the nurse? A. A client suffering from a migraine headache develops flushing after administration of prescribed intranasal sumatriptan. B. A client diagnosed with amyotrophic lateral sclerosis, ALS, experiences coughing during attempts to eat and drink. C. A client with a cerebral aneurysm expresses nervousness about their upcoming surgery scheduled within an hour. D. A client diagnosed with bacterial meningitis receiving a third dose of intravenous doxycycline presents with a rash on their torso. The correct answer is B. This client's symptoms suggest a risk of aspiration, a serious concern necessitating follow-up. ALS, a neurodegenerative disease, leads to muscle weakness and often requires respiratory support, such as a tracheostomy. Choice A is incorrect. Flushing after sumatriptan administration is a common side effect. Although potentially indicative of more severe complications, it doesn't take precedence over a client showing symptoms of aspiration. Choice C is incorrect. Pre-surgery nervousness, especially before a high-risk procedure like cerebral aneurysm repair, is typical and doesn't demand immediate attention compared to the client exhibiting symptoms of aspiration. Choice D is incorrect. While rashes are a potential side effect of antibiotics like doxycycline, in this case, they likely represent a common reaction rather than a severe allergic response. Immediate follow-up is unnecessary. Hey, future nurses! Are you looking for an online NCLEX course? You're in the right place. Embark on your journey to NCLEX success with our all-inclusive online course, offering a comprehensive blend of animated crash courses, recorded video lectures, a question bank containing over 3,000 practice questions, NGN questions, mock exams for a realistic test experience, audiobooks, ebooks, and a bullet points book. Everything you need to ace the exam all in one place. Here's a sneak peek into what our course offers. Animated Crash Course. Engaging animations cover all key topics tested in the NCLEX exam. With over 100 questions derived directly from our crash course, you'll be prepared for anything the exam throws at you. Recorded video lectures. Learn from the best NCLEX trainers in the world. Our recorded lectures provide in-depth explanations and strategies to tackle even the toughest questions. Question Bank. Practice makes perfect. Access over 3,000 NCLEX practice questions carefully selected based on the most frequently tested topics over the past 5 years. NGN Questions. Gain access to next-generation NCLEX-style questions to familiarize yourself with the latest exam formats and requirements. Mock exams. Experience the real exam environment with our mock tests designed to simulate the NCLEX exam to perfection. Audiobook and ebook. Study on the go with our audiobook and ebook versions covering all essential nursing topics for your convenience. Bullet Points Book. Need a quick review? Our Bullet Points book condenses key information into easy-to-digest format for fast revision. Don't miss out on this opportunity to accelerate your journey towards becoming a licensed nurse. Enroll now and enjoy a 70% discount exclusively for early birds. Act fast, as this offer is valid only for this month. After that, prices will rise. Don't let this chance slip away. Invest in your future today. When triaging pediatric clients, the nurse's primary focus should be on promptly addressing the most urgent needs. Which of the following clients should the nurse prioritize? A. An 8-year-old who has burned her right forearm in scalding hot water. B. A 3-year-old exhibiting drooling and reluctance to swallow. C. A 10-year-old complaining of a persistent headache for 2 days. D. A 12-year-old reporting excessive thirst accompanied by a fever. Option B is the correct choice. A child displaying drooling and reluctance to swallow suggests a potential case of epiglottitis, a critical condition requiring immediate attention. The nurse should prioritize assessing this child and promptly alert the physician if an emergency tracheostomy is necessary. Option A is not the priority. While a burn injury to the forearm requires medical attention, it does not pose an immediate threat to the airway as epiglottitis does. Option C is also not the priority. While a persistent headache warrants assessment, it does not take precedence over a potentially life-threatening airway obstruction. Option D is not the priority either. Although excessive thirst and fever indicate potential health issues like hyperglycemia or dehydration, they do not pose an immediate threat to the airway like epiglottitis does. After receiving an IV dose of morphine, 5 mg, for neuropathic pain associated with diabetic neuropathy, the client exhibits a decrease in respirations to 7 per minute and a drop in blood pressure from 130/80 mmHg to 84/68 mmHg. Which nursing intervention is most appropriate? A. Administer naloxone. B. Prepare for intubation. C. Start an IV infusion of normal saline. D. Prepare to initiate a dopamine infusion. The correct choice is A. Administer naloxone. The client is displaying signs of morphine toxicity, necessitating the administration of naloxone, Narcan, as an antidote to reverse respiratory depression. Choice B is incorrect. Intubation may be necessary in severe cases of respiratory depression, but administering an antidote to counteract morphine toxicity is the immediate priority. Choice C is incorrect. While starting an IV infusion may be necessary to address potential fluid volume deficit, the primary action should focus on administering the antidote to morphine toxicity. And choice D is incorrect. Initiation of a dopamine infusion may be considered for hypotension refractory to fluid resuscitation, but addressing morphine toxicity with naloxone is the immediate priority. Here's the next most important NCLEX review question. A patient expresses to the nurse that she is embarrassed by the appearance of her hair and expresses a desire to wash her hair prior to the completion of her daily tests and visits. When it comes to the patient's care, how should the nurse prioritize it? A. It is a responsibility of the nurse to explain to the patient that she does not have sufficient time to wash her hair today due to the fact that she has an excessive number of important medical tests and appointments. B. First and foremost, the nurse needs to schedule the testing and meal preparation, and then she should finish the hygiene as soon as time permits. C. Changing the dressings should be done first, followed by scheduling testing and counseling, and finally completion of hygiene. D. Making arrangements to wash the patient's hair and perform hygiene is the initial step, followed by scheduling diagnostic testing and counseling sessions. Correct answer is option D. Let's understand why option D is correct. When it comes to scheduling nursing care, the priorities that the patient has chosen as being the most important are the ones that would be considered the most immediate priorities, provided that time restrictions allow for them. It is not correct to select options A, B, or C, because the act of washing the patient's hair and providing assistance with cleanliness is an example of putting the patient first, and establishing a foundation for a fruitful relationship between the nurse and the patient. When dealing with a patient who is stable, diagnostic tests and dressing changes can most certainly be postponed until after the patient has established their individual priorities. Alright class, let's move on to the next set of important NCLEX questions and answers. A nurse in a clinic is in charge of triaging incoming phone calls. It is the responsibility of the nurse to initially follow up with the patient who reports A. A drop in libido at the same time when dutasteride was being administered. B. Swelling in their right leg when they were taking the tamoxifen that was recommended to them. C. During the course of treatment with letrozole, I experienced nocturnal sweats and hot flashes. D. Bone discomfort when using filgrastim supplement that was prescribed. The correct answer is option B. Do you know why? An example of a hormone antagonist is tamoxifen. To be more specific, it's an estrogen antagonist that inhibits breast cancer that is hormone receptor positive. Tamoxifen is associated with an increased risk of adverse coagulation events, including deep vein thrombosis, DVT, venous thromboembolism, and pulmonary embolism, PE, for reasons that are not entirely known. If a deep vein thrombosis, DVT, is not recognized and treated in a timely manner, the patient may develop a PE, which can be potentially fatal. If a patient using tamoxifen suffers signs of deep vein thrombosis, DVT, or pulmonary embolism, PE, dyspnea, chest pain, they should immediately report those symptoms to their healthcare provider. Choice A is incorrect because dutasteride, together with finasteride, is a medication that can be used to treat androgenic alopecia, as well as some prostate malignancies. It works by inhibiting the activity of dihydrotestosterone. When the client's DHT levels are lowered, they put themselves at risk for experiencing erectile dysfunction, losing muscle mass, and becoming hormonally blunted. Since this finding is anticipated, there's no immediate need for further investigation. Choice C is incorrect because in the treatment of some breast tumors, the aromatase inhibitor letrozole is used. Hot flashes and night sweats are two examples of vasomotor symptoms that the patient can encounter as a result of taking this medicine. The use of venlafaxine, which is prescribed, has the potential to mitigate this usual and anticipated finding. Choice D is incorrect because filgrastim is a colony-stimulating factor that targets the treatment of chemotherapy-induced leukopenia and neutropenia. Its therapeutic purpose is to treat these conditions. As a result of increased bone marrow activity, this medicine creates discomfort in the bones for the patient. Acetaminophen might be able to alleviate the symptoms of this result, which is something that was anticipated. Okay, students, let's delve into the next crucial NCLEX questions and answers. Pay close attention, as this question is vital for your NCLEX exam. Here's the question. Before we move on to the next question, we have urgent news for you. We've meticulously crafted a 100-hour animated NCLEX review crash course. In the initial 30 hours, we comprehensively cover all the crucial NCLEX topics with engaging animations. But that is just the beginning. The remaining 70 hours are dedicated to dissecting 5,000 NCLEX questions through dynamic animations. Along with animated lectures, you will also get NGN questions, an ebook, practice test series, and many more resources. Imagine learning with interactive visuals instead of being buried in a mound of tedious text. Say farewell to monotonous study sessions and welcome a revolutionary animated learning experience. This 100-hour course is your passport to mastering the NCLEX exam with unwavering confidence. Remember, animation significantly enhances information retention. Don't miss out on this limited time offer. We're offering an astounding 70% off for this month only. Click the link below, enroll today, and embark on a journey where animated education leads to exam triumph. Your success story begins now with our 100-hour animated NCLEX course at an incredible 70% off. Enroll immediately and wave goodbye to dreary textbooks. Now, let's swiftly move on to the next question. The nurse is currently attending to a predetermined set of patients. Which patient should the nurse prioritize checking in with immediately? A. A patient showing redness at the insertion site with a closed drainage system to the chest. B. A patient undergoing therapy for ulcerative colitis who has had 3 bloody stools within the last hour. C. A patient with a headache rated as 4 on a pain scale receiving treatment for a concussion. D. A patient with a blood pressure reading of 103/56 mmHg currently undergoing treatment for an ischemic stroke. Think carefully before responding. Now, the correct answer is D. Let's dissect why. Individuals recovering from an ischemic stroke require close monitoring of their blood pressure. Maintaining a blood pressure around 150/100 mmHg ensures adequate cerebral perfusion to unaffected brain regions. This balance, termed permissive hypertension, prevents further damage. However, blood pressure below 150/100 mmHg could reduce cerebral perfusion, exacerbating the condition. Conversely, excessively high blood pressure, over 185 over 110 mmHg, may prolong the stroke. Options A, B, and C may raise concerns, but they don't demand immediate attention. Redness at a drainage site could signal infection but doesn't require urgent intervention. Bloody stools are common in ulcerative colitis therapy. Quick follow-up isn't warranted after medication. Headaches post-concussion are anticipated. Alarming symptoms like vision changes or vomiting would necessitate urgent evaluation. As a patient presents with agitation, nuchal stiffness, and a fever, the nurse working in the emergency department, ED, is tasked with providing care. What is the initial step that the nurse should take among the following actions? A. Administer ibuprofen as prescribed. B. Place the patient on droplet precautions. C. Inform the Department of Public Health. D. Obtain blood cultures as prescribed. Correct answer, B. This situation warrants immediate attention to prevent potential transmission of illness. The symptoms described, fever, neck stiffness, and altered mental status, are indicative of bacterial meningitis. It is imperative for the nurse to prioritize infection control to safeguard both patients and staff. Therefore, the first step is to initiate droplet precautions, ensuring that the patient is placed in a room where all individuals, including visitors and staff, wear surgical masks. Options A, C, and D are incorrect. Let us understand why these are wrong. While fever-reducing medications like acetaminophen or ibuprofen may be beneficial for a patient with bacterial meningitis, the primary concern at this juncture is infection control rather than symptom management. Although notifying the public health department is crucial for initiating contact tracing if bacterial meningitis is confirmed, it is secondary to immediate infection control measures. While obtaining blood cultures is important for confirming the diagnosis and guiding treatment, it is not the initial step. Infection control takes precedence to mitigate potential transmission in the ED setting. Let's proceed to the next NCLEX review question. The scenario presents the nurse discussing tasks assigned to various clients. What action holds the utmost importance? A. A client reporting blurry vision in one eye may benefit from a visual acuity test. B. A patient experiencing chest pain underwent an ECG with 12 leads. C. When a patient complains of syncope, orthostatic vital signs should be taken. D. A client recently diagnosed with hypertension will receive discharge instructions. The correct answer is option B. An electrocardiogram, ECG with 12 leads, is crucial for assessing a patient with chest pain. This test aids in diagnosing acute myocardial infarction, MI, by detecting ST elevations. Rapid diagnosis and treatment are paramount for improved outcomes, as guidelines recommend obtaining an ECG within 10 minutes of arrival at the emergency room, particularly for suspected ST elevation myocardial infarction, STEMI. Options A, C, and D are not the most pertinent actions. While obtaining orthostatic vital signs is crucial for a patient experiencing syncope, it is secondary to obtaining an ECG for suspected myocardial infarction. Prioritizing a visual acuity test for a client with blurry vision in one eye using a Snellen chart is less urgent. Discharge instructions for a client with hypertension, while important, do not take precedence over urgent diagnostic measures for chest pain, potentially indicative of MI. Now, let's delve into the next crucial NCLEX questions and answers. Clients who have been allocated to the nurse are being cared for by the nurse. It would be of the utmost importance to follow up with a client who A. Has a heart rate of 110 beats per minute and experiences atrial fibrillation. B. Suffers from chronic obstructive pulmonary disease, COPD, and has an oxygen saturation of 92% when breathing standard room air. C. Receives amphotericin B, and the most recent temperature is 100.5 degrees Fahrenheit, 38 degrees Celsius. D. Has a blood pressure reading of 135 over 89 mmHg, and is suffering from glomerulonephritis. The correct answer is option A. For the patient experiencing atrial fibrillation with a heart rate of 110 beats per minute, it's crucial to address this promptly. Atrial fibrillation can lead to serious complications, including stroke, so managing the heart rate within the appropriate range is vital. Medications such as diltiazem or amiodarone may be necessary to control the heart rate and prevent adverse outcomes. Options B, C, and D do not require immediate follow-up. Option B, while a COPD patient with 92% oxygen saturation may need monitoring and potentially intervention, this does not require immediate attention as it falls within an acceptable range for COPD patients. Option C, a patient receiving amphotericin B may experience fevers and chills, but this is a known side effect that can be managed with acetaminophen and fluids. Immediate follow-up is not necessary. Option D, glomerulonephritis, can lead to increased blood pressure, but a reading of 135/89 mmHg does not indicate a hypertensive crisis requiring urgent attention. This patient may need monitoring and management for blood pressure, but not immediate follow-up. The priority remains on addressing the patient with atrial fibrillation to prevent potential complications like stroke. Without further ado, it's time to explore the pivotal NCLEX questions and their answers. The nurse is providing care for the following patients who have been assigned to her. The nurse would make it a top priority to conduct an assessment of which patient? A. Demanding medication to alleviate the severe pain they got in their knees and back. B. Following the administration of albuterol, the patient had reported feeling apprehensive. C. Undergoing evaluation for chest pain and asking for an antacid for dyspepsia is the current situation. D. Teaching them how to use their insulin pump and glucometer while they wait for discharge. The correct answer remains option C. For the patient undergoing evaluation for chest pain and requesting an antacid for dyspepsia, it's crucial to conduct a thorough assessment. Recent reports suggest that gastrointestinal symptoms such as dyspepsia can sometimes be related to myocardial infarction, which makes this symptom concerning given the context of the patient's current evaluation for chest pain. The nurse needs to investigate this further to rule out any cardiac issues. Options A, B, and D do not require immediate priority. Option A, while chronic pain management is important, it doesn't take precedence over acute issues such as chest pain evaluation, especially considering the potential cardiac implications. Option B, feeling apprehensive after albuterol administration is a known side effect due to its stimulation of beta-adrenergic receptors. While it's important to monitor the patient, it doesn't require immediate follow-up compared to the patient with chest pain and dyspepsia. Option D, teaching a patient how to use an insulin pump and glucometer while awaiting discharge is important for their ongoing care, but it's not an immediate priority compared to assessing a patient with potential cardiac symptoms. The priority remains on assessing the patient with chest pain and dyspepsia to ensure timely intervention and rule out any serious cardiac issues. Moving forward, we'll tackle the next most important NCLEX review questions. It has come to the nurse's attention that the following client circumstances have occurred. Before anything else, the nurse needs to follow up with the patient who A. Who has pneumonia and whose temperature rose to 102 degrees Fahrenheit. B. Despite having active pulmonary tuberculosis, TB, the individual refuses to take the drugs that have been given to them. C. A patient who is currently undergoing therapy for atrial fibrillation and has an erratic pulse. D. Is experiencing a sudden cessation of wheezing on account of having nebulizer treatments for asthma. The correct answer remains option D. The nurse's priority is to ensure the safety and well-being of the patients under their care. In this scenario, the patient experiencing a sudden cessation of wheezing due to nebulizer treatments for asthma requires immediate follow-up. While wheezing is a typical symptom of asthma exacerbation, the sudden cessation of wheezing could signify a severe underlying issue, potentially leading to respiratory failure. Thus, prompt intervention is necessary to address this critical situation and ensure the patient's health and stability. Options A, B, and C do not warrant immediate follow-up. Option A is not the priority because while a patient with pneumonia and a temperature of 102 degrees Fahrenheit requires attention, it does not pose an immediate threat compared to the potential respiratory emergency indicated by the sudden cessation of wheezing. Option B is not the priority because although a patient with active pulmonary tuberculosis, TB, refusing medication is concerning, it does not require immediate follow-up compared to addressing the respiratory distress indicated by the sudden cessation of wheezing. Option C is not the priority, because while a patient undergoing therapy for atrial fibrillation with an erratic pulse may require monitoring and potential medication adjustments, it is not as urgent as addressing the potential respiratory emergency indicated by the sudden cessation of wheezing. Therefore, the nurse's primary focus should be on addressing the sudden cessation of wheezing in the patient receiving nebulizer treatments for asthma to prevent respiratory failure and ensure appropriate intervention. Without delay, let's progress to the next NCLEX questions. An individual who is suspected of having meningitis is being cared for by the nurse. After performing a lumbar puncture (LP) operation, the nurse should do which of the following actions as a priority? A. Brzezinski's sign should be evaluated for the patient. B. Take a look at the gag reflex. C. Adjust the height of the head of the bed to 30 degrees. D. Inducing the consumption of oral fluids. The correct answer is option D. Do you know why? Encouraging the patient to consume oral fluids is essential after a lumbar puncture procedure to replenish the cerebral spinal fluid, CSF, lost during the process. This helps maintain adequate CSF volume and prevents complications. Options A, B, and C are incorrect. Let's understand why these options are incorrect. Option A, evaluating the Brzezinski sign, involves flexing the patient's neck to assess for meningeal irritation, which may be indicative of meningitis. However, this assessment is not directly related to the immediate post-procedure care of a lumbar puncture. Option B, assessing the gag reflex, is not typically part of post-lumbar puncture care. The focus is on monitoring for complications related to CSF leakage and ensuring adequate fluid intake. Option C, adjusting the height of the bed to 30 degrees, is not a priority immediately after a lumbar puncture. In fact, maintaining a flat posture for several hours post-procedure is often recommended to minimize the risk of complications such as CSF leakage and headaches. The priority remains on encouraging the patient to consume oral fluids to maintain CSF volume after the lumbar puncture procedure. The parents of a child who has recently been diagnosed with asthma are participating in a teaching session that is being led by the nurse. Which is the most important subject for the nurse to discuss? A. There are community resources available for the management of asthma. B. Learn how to operate a peak flow meter. C. It is essential to maintain a current immunization schedule. D. Manifestations of an asthma attack can be seen here. The correct answer is option D. Understanding the manifestations of an asthma attack is crucial because it allows for prompt recognition and intervention. Symptoms such as chest tightness, increased respirations, use of accessory muscles, and audible wheezing indicate worsening asthma and require immediate action, often in the form of prescribed albuterol via an inhaler. Prompt recognition and treatment can help prevent exacerbation and reduce the risk of complications. Options A, B, and C are incorrect. Option A is incorrect, and let's understand why. While community resources for asthma management are important, they are not as immediately relevant as recognizing and addressing symptoms of an asthma attack. Option B is incorrect. Let's understand why. Learning how to operate a peak flow meter is valuable for monitoring asthma control, but it is not the priority in the context of an acute asthma attack. Option C is incorrect. Let's understand why. While maintaining a current immunization schedule is essential for overall health, it does not take precedence over recognizing and managing symptoms of an asthma attack. The priority remains on understanding and recognizing the manifestations of an asthma attack to ensure timely intervention and prevent exacerbation. When patients are ready to be discharged from the nursing unit, the charge nurse goes through their medical records and reviews them. It is advised that the following customer be recommended for disease management services if the customer has A. Been admitted 3 times in the past 2 months due to congestive heart failure, CHF.
Stan Coast NCLEX
B.
Coaching.
Been diagnosed with epilepsy and experienced 1 seizure after switching anti-epileptic medications. C. A rise in hemoglobin A1C from 6.7% to 6.9%, indicating the presence of diabetes mellitus. D. Antipsychotic medication in the form of long-acting injectables is being used instead of daily doses for schizophrenia. The correct answer is option A. Due to the fact that this client has been admitted to the hospital on many occasions, a referral for disease management is required. A coordinated series of interventions that strive to maximize the client's functionality while simultaneously limiting problems associated to the condition is what we mean when we talk about disease management. Because of the high cost of hospitalizations and the possibility of problems occurring during hospitalizations, this customer is an excellent candidate for disease management services. It is not correct to select options B, C, or D. It is not uncommon for a patient to experience a seizure while switching anti-epileptic medications. When one therapeutic level decreases, it takes some time for the other level to grow. This is the explanation for this assertion. A referral to disease management is not required in the event that a seizure occurs in isolation. A higher hemoglobin A1C level was observed in the diabetic customer who was being treated. On the other hand, it's still lower than the target of 7% that was set. A trend should be established for the A1C, and the nurse should continue to urge for more frequent monitoring of blood glucose levels and adherence to medications that have been given. It's an effective method to maximize adherence and minimize exacerbations, psychosis, when a client with schizophrenia is switched to a long-acting injectable medication. A single injection of these long-acting injectables is administered to the patient, and they will need to return in a few weeks for another treatment. A female patient who is 50 years old and goes to the emergency room, ED, with complaints of dyspnea, weariness, and indigestion can be understood. What is the most important action that the nurse should take? A. 12-lead electrocardiogram should be obtained. B. Make available additional oxygen through the nasal cannula. C. Intravenous IV access that has been established. D. Listen for chest and lung sounds. The correct answer is option A. In light of the fact that the patient is displaying characteristic signs of acute coronary syndrome, ACS, the most important thing to do is to get a 12-lead ECG. The likelihood of acquiring this potentially lethal illness is significantly increased in women who are above the age of 50. There are various indications that women may experience in addition to substernal chest pain. The electrocardiogram will assist in determining if the patient is suffering from an STEMI or an NSTEMI. It is not correct to select options B, C, or D. A respiratory evaluation, the administration of supplemental oxygen, and the establishment of intravenous access are all going to be necessary. Nevertheless, they do not place a high priority on determining the severity of the ACS because the electrocardiogram will identify whether or not the patient has an STMI. As an additional point of interest, the client mentioned that she was having trouble breathing, which does not necessarily mean that she is hypoxic. When symptoms are first seen, it is recommended that a 12-lead electrocardiogram be obtained within 10 minutes. This is the standard of care. In addition to this, the clinical manifestations of unstable acute coronary syndrome, STEMI, might be either typical or unusual. Typical clinical manifestations of acute coronary syndrome include the following: pain in the substernal region of the chest that comes on gradually. Pain that is felt in the jaw or arm as it radiates. Pain in the chest that does not change even after resting. It's possible that other findings include pallor or diaphoresis. The following are examples of atypical clinical characteristics of ACS. Symptoms of nausea and vomiting, defiant breathing, excessive levels of exhaust, epigastric discomfort. It's common for women and people who have diabetes mellitus to have characteristics that are not usual. Due to neuropathy, people who have diabetes mellitus experience less chest pain than those who do not have the condition. For the purpose of preventing venous thromboembolism, VTE, the nurse is providing care for a patient who is getting oxygen through a nasal cannula and has been prescribed warfarin. The nurse is informed by the unlicensed assistive personnel, UAP, that the patient is experiencing a drip from their nose. In the beginning, A. It is recommended that the unlicensed assistive persons, UAP, apply water-soluble jelly to the nares. B. This is the most recent activated partial thromboplastin time, APTT, that you should study. C. Examine the patient to see whether they have any bruising or bleeding gums. D. Acquire a directive to humidify the oxygen in the air. Correct answer is choice C. The initial step that the nurse should take is to conduct an assessment of the patient and identify whether or not there are additional causes of bleeding. In patients who are receiving oxygen therapy, the most prevalent cause of nasal bleeding is dryness of the nasal passages. However, the patient is also using warfarin, which is an anticoagulant medication. Hence, the supertherapeutic international normalized ratio, INR, should be taken into consideration when making a differential diagnosis of nasal bleeding among the patient. While this is happening, the only symptom that may be present is bleeding from the nose, and a considerably prolonged INR may be accompanied by bleeding from other places. The findings of such an examination might lend support to the clinical diagnosis of excessive anticoagulation caused by warfarin. Afterwards, it's necessary to acquire an INR level. Option A is incorrect. The client should be evaluated by the nurse, and the UAP should not be sent back. It is not reasonable for the nurse to presume that nasal dryness is the only factor contributing to nasal bleeding in a patient who is taking warfarin. It is necessary to do an evaluation on the patient in order to ascertain the cause of the condition. It's reasonable to assume that the nasal dryness is the source of such localized bleeding if the findings of the evaluation do not disclose any other bleeding sites, and if the international normalized ratio, INR, remains within the therapeutic range. Option B is incorrect. The INR level of the patient should be reviewed by the nurse, not the APTT level. In the case of a patient who's on heparin, the INR is affected by warfarin, and the APTT is carefully watched. Option D is incorrect. The dry oxygen or air that is provided by a nasal cannula or face mask can be humidified with the assistance of a bubbler. In the event that nasal dryness is the root cause of epistaxis, this supportive strategy will undoubtedly be of assistance. If, on the other hand, the explanation is a supratherapeutic elevated INR, then additional measures, such as holding warfarin, might be required. Consequently, further evaluations need to be finished before anything else. In addition to this, warfarin should not be used in the following categories of patients. This is because warfarin has the potential to raise the risk of bleeding, and it should not be administered to anyone who is currently experiencing active bleeding. Warfarin should not be used by those who have experienced a hemorrhagic stroke, which is a type of stroke that is caused by bleeding in the brain. This is because warfarin has the potential to raise the risk of bleeding and make the stroke even more severe. In the context of pregnancy, the use of warfarin is not recommended because it has the potential to cross the placenta and result in birth abnormalities or bleeding in the developing fetus. In the context of severe liver or kidney disease, warfarin is processed in the liver and eliminated by the kidneys. Thus, persons with severe liver or kidney illnesses may not be able to metabolize or excrete the medicine correctly. Warfarin hypersensitivity. Individuals who have previously experienced an allergic reaction to warfarin should not use the medicine and should instead avoid taking it. The nurse, who is now working on the medical surgical unit, has been given the responsibility of acting as a preceptor for a newly hired nurse. In the event that the newly recruited nurse were to complete the first of the following tasks, which of these would be an indication of the capacity to prioritize appropriately? A. Provides instruction on how to walk on crutches to a patient who is set to be discharged. B. A client who requires an emergency laparotomy provided informed permission to the attending physician. C. Provides irrigation to an ostomy patient who is experiencing abdominal cramping. D. A client who has diabetes insipidus, DI, is given a calculation that determines their intake and output. The correct answer is option B. An RN is qualified to act as a witness when consent is being given. In order to prevent a delay in care, the registered nurse will need to provide immediate attention to the patient who requires emergency surgery. Despite the fact that the primary healthcare provider, PHCP, has the authority to override consent, this privilege is often reserved for patients who are unable to communicate due to their condition. It is not correct to select options A, C, or D. In order for the nurse to concentrate on client circumstances that are of urgent concern, discharge education is a task that is considered to be of low importance. It is a priority to irrigate an ostomy for a patient who is experiencing stomach cramps. However, this does not take precedence over the client who requires emergency surgery. There is a low importance on the duty of calculating intake and outflow. Additional information: an essential component of being a nurse is making the care of patients a top priority. Situations involving clients that are considered to be of high priority include reporting an acute change or an unstable patient. High-priority things should always be addressed by the nurse, and, if necessary, she should delegate intermediate to low-priority items in an appropriate manner. In the pediatric unit, the nurse is caring for a patient who is 11 years old and has a cast that is below the knee on the left side. It has been reported that the client is experiencing pain and numbness. A cold sensation is felt in the toes of the left foot as observed by the nurse. What is the first step that the nurse ought to take among the following actions? A. Remove the cast. B. Instruct the child to walk about. C. Send a message to the doctor. D. Raise the leg by placing it on 2 pillows. Correct answer is choice C. Already, the patient is exhibiting symptoms that are consistent with compartment syndrome. As a result of inadequate perfusion, the patient is experiencing pain, numbness, and cold feet. There are the 5 P's that are related with compartment syndrome: discomfort, absence of a pulse, paleness, symptoms of paresthesis, a state of paralysis. The syndrome of compartments is a critical condition. In the event that the nurse is able to identify the signs and symptoms of compartment syndrome, she should immediately inform the attending physician. In the anterior compartment of the leg, compartment syndrome is more prevalent than in other compartments. It is frequently the result of trauma. In the aftermath of a trauma, there is a possibility that the intracompartmental space will diminish, or that the intracompartmental fluid volume would increase due to a fracture, hematoma, or other factors. The compartment pressure rises as a result of the non-compliant nature of the fascia that surrounds the compartment. It is natural for there to be a balance between the outflow of blood from the veins and the influx of blood from the muscles. On the other hand, an increase in compartmental pressure leads to a decrease in the discharge of blood from the veins. The result is that the pressure in the veins rises, which in turn contributes to an increase in the pressure in the compartments. When the pressure in the compartments rises to a level that is higher than the pressure in the arterial system, arterial blood flow is blocked, which leads to ischemia. Over a longer period of time, ischemia can lead to permanent necrosis, which is the death of tissue. Option A is incorrect. Since the youngster has compartment syndrome, there are indications that the child's neurovascular system is compromised. However, removing the cast is not the first step that the nurse should do in order to alleviate the pressure that is being applied to the patient. After alerting the attending physician, the removal of the cast should be scheduled. It's imperative that the physician be informed as soon as possible that fasciostomy may be required. Option B is incorrect. Because the child's danger of future harm will grow if they walk, it's best to refrain from ambulating the child. And option D is incorrect. Once the injured limb has been brought to the attention of the attending physician, it should be positioned at the level of the heart and not above the heart level. An elevation that is higher than the level of the heart may be beneficial for venous drainage. However, it also lowers arterial input even further and makes the ischemia worse. It's important to take note that it's recommended to elevate the limb above the level of the heart in order to reduce edema and prevent compartment syndrome shortly after the cast has been applied. The limb must not be lifted when compartment syndrome has already occurred. This is a strict condition. The nurse has been given the following medications for patients who have recently been admitted to the hospital. Which ought the nurse do first? A. Assist a patient who is suffering from a stage 3 pressure ulcer and irrigating a wound.
Stan Coast NCLEX
B.
coaching.
Ensure that a patient who is using a halo fixation device receives complete pin care. C. Diazepam should be given to a patient who is experiencing delirium tremens, DTs. D. An indwelling urinary catheter should be inserted into a patient who is experiencing retention. Correct answer is C. An extreme form of alcohol withdrawal is known as delirium tremens, or DTs for short. The implementation of this prescription ought to take place without delay because the potential for seizure activity is rather substantial. It is not correct to select options A, B, or D. The client who is experiencing an urgent threat of having a seizure is a higher priority than these medications, which require a significant amount of time and are of lower importance. The nurse is responsible for prioritizing actions based on the severity of the patient's condition and the amount of time required to finish each duty. All activities that are associated with the discharge of patients are considered to be of low importance, as are any changes to the dressing. The nurse is providing medical attention to a child who was bitten by a rabid animal and is currently being treated in the emergency department, ED. What is the first step that the nurse ought to proceed with? A. Determine the length and width of the wound. B. Purify the wound by washing it with soap and water. C. Get a prescription for an antibiotic. D. Animal control should be notified about the bite. The correct answer is option B. In order to avoid contracting rabies, it is critical to use soap and water to clean the wound that was caused by an animal that is infected with the disease. Through aggressive wound cleaning, the risk of exposure to this illness is reduced. This infection, if left untreated and without the required cleaning and post-exposure prophylaxis, can be lethal. Option A is incorrect. When performing a general wound assessment, it is important to determine the length and width of the wound. However, the most important thing to do after being bitten by an animal is to thoroughly clean the wound in order to avoid the spread of bacteria and viruses, including rabies. Option C is incorrect. In the case of a wound, antibiotic medicine might be necessary for certain individuals. Under no circumstance would this take precedence over the most fundamental form of first aid, which is to clean the wound with soap and water. Option D is incorrect. It is essential to make certain that all animal bites are reported to public health authorities in order to facilitate the process of determining whether or not rabies prophylaxis is required in the event that it is deemed necessary. When it comes to reporting, direct client care and first aid measures, such as completely cleansing the wound, are not given priority consideration. A virus is responsible for the deadly sickness known as rabies. One of the ways in which the virus is transferred to humans is by the saliva of an infected mammal, which can be introduced through a bite or surface abrasion. Raccoons, skunks, bats, and foxes are some of the creatures that are particularly susceptible to contracting rabies. It is important for the nurse to thoroughly irrigate the wound with soap and water after any animal bites that have occurred. It is imperative that this be done in order to stop the spread of the virus and other infectious agents. If a client gets bitten by a wild animal, it is presumed that they have been exposed to the rabies virus. The symptoms of rabies include symptoms similar to those of the flu, seizures, hallucinations, and hypersalivation. Rabies can be fatal if it is not prevented through the use of immunoglobulin. A nurse who is employed on a medical surgical unit is responsible for providing care to individual patients. The nurse ought to make preparations to determine the client's first condition. A. 12 hours ago, the patient underwent a partial thyroidectomy and is experiencing trouble swallowing. B. After a sterile dressing change for a stage 4 pressure ulcer, the patient indicates that they are experiencing greater pain. C. Has been diagnosed with pneumonia of both lower lobes and has not utilized the incentive spirometer for the past 6 hours. D. Does not have the informed permission signed despite the fact that an adrenalectomy is planned to take place in 8 hours. The correct answer is option A. When performing a partial thyroidectomy, it is necessary for the nurse to keep a close eye on the patient for any complications, such as laryngeal edema. Stridor, trouble swallowing, and hoarseness of the voice are all possible manifestations of this condition. In order to avoid this issue, the primary healthcare provider, PHCP, could recommend that the patient take post-operative steroids. A follow-up appointment with this patient is required so that the nurse may evaluate the patient's airway patency. It is not correct to select options B, C, or D. Pain that occurs after a dressing change is extremely common and calls for general follow-up care being administered. By administering prescribed analgesics to the patient prior to changing the dressing, the nurse can alleviate the pain that the patient is experiencing. When dealing with a patient who has pneumonia, one of the most important interventions is to mobilize and use the incentive spirometer, IS. It is normal practice to administer the incentive spirometer on an hourly basis while the patient is awake. This is not the most important thing, but it does require general follow-up. To conclude, it will be necessary to assess the client's consent in order to finish the process. The nurse, on the other hand, has plenty of time to complete this duty because the surgical surgery is scheduled to take place in 8 hours. In addition to this, following a thyroidectomy, the following are some of the most common issues that can arise. Hypocalcemia is a condition that occurs when the parathyroid gland is removed or injured accidentally, resulting in a decrease in the amount of calcium in the bloodstream. In addition to the Chauvet sign, which is characterized by facial twitching when tapping on the cheek, Trousseau's sign, which is characterized by carpal pedal spasms when applying pressure to the arm, muscle cramps, paresthesia, perioral numbness, tetany, seizures, and cardiac arrhythmias. Acute hypocalcemia can also be characterized by these neurological manifestations. It is possible that it could be fatal if it is not addressed. To avoid this issue, every patient who has undergone a thyroidectomy is instructed to begin taking 3 grams of elemental calcium on a daily basis as soon as they are able to start eating orally. When the recurrent laryngeal nerve, RLN, is injured, it is usual for the patient to have hoarseness of voice. This is because the RLN is damaged during the surgical procedure. In the aftermath of a thyroidectomy, it is vital for the nurse to possess breathing equipment and calcium gluconate that are effortlessly accessible. The nurse has been given the following medications for patients who have recently been admitted to the hospital. What is the first drug that the nurse should give to the patient? A. In the treatment of anemia, give subcutaneous epoetin. B. Opioid pain medication taken orally. C. Treatment of sepsis with intravenous fluids. D. For the treatment of anxiety, intramuscular IM hydroxine. Correct answer is choice C. It is essential to deliver intravenous fluids that are suggested for sepsis. The nurse needs to be aware that the protocol for sepsis includes the administration of fluids and antibiotics at the appropriate times. Given the patient's diagnosis, this particular patient is the most critical patient, and the nurse ought to give this drug the highest priority. It is not correct to select options A, B, or D, given that it will take many weeks for epoetin to have its full therapeutic benefit. The other options are not a priority. In addition, the onset of pain relief with oral administration will take some time. Finally, the diagnosis of anxiety will not be given priority over the physiological risk of sepsis under any circumstances. In addition to this, the condition known as sepsis can be extremely dangerous and can even lead to shock if the patient is not treated as soon as possible. In the treatment of sepsis, boluses of isotonic fluid and antibiotics that are appropriate are essential components. It is imperative that the nurse undertake these interventions as quickly as possible in order to prevent the client from experiencing a decline. The nurse is providing care for a number of patients at this time. Regarding which client situation is it of the utmost importance to follow up? A client A. In addition to taking albuterol through a nebulizer, the patient was admitted with an asthma exacerbation that was causing wheezing. B. A patient that is admitted with pulmonary emphysema and puts on their nasal cannula oxygen before eating. C. The patient that is walking around the nursing unit while wearing a surgical mask. The patient is suffering from pneumonia. D. Oxygen is being delivered using a non-rebreather, and the individual's oxygen saturation level is 93%. The correct answer is choice D. A patient who is receiving oxygen with a non-rebreather is receiving FiO2 at a concentration of around 80 to 95%. In the event that the optimal oxygen saturation level is 93%, this is cause for concern and may call for more active steps to be taken in order to improve oxygen saturation. The oxygen saturation level of the patient who is receiving this particular sort of supplemental oxygen device ought to be significantly higher. It is not correct to select options A, B, or C. Tachypnea and wheezing are examples of manifestations that a patient who has been admitted suffering from an asthma exacerbation would experience. Due to the fact that the treatment that was prescribed is now being delivered, this is not a priority. There is a cause for concern in the event that the wheezing does not improve or if there is an abrupt stop of wheezing. Consuming food while using a nasal cannula is recommended for patients who have had pulmonary emphysema since it raises the amount of oxygen that is required. When a patient is diagnosed with pneumonia, it is important to urge them to walk around the nursing unit. This patient is wearing the required personnel protective equipment, PPE, which is a surgical mask. In addition to this, a non-rebreather is a device that is used to distribute oxygen, and it has the potential to deliver the maximum oxygen level in low-flow treatment systems. This device is equipped with a reservoir bag, which enables the client to take oxygen from the reservoir. Furthermore, flaps prevent air from the surrounding environment from accessing the exhalation ports. The primary healthcare provider, PHCP, may explore intubation and mechanical breathing as potential treatment options in the event that a patient is not responding positively to the therapy being administered. When the non-rebreather therapy is commenced, it is important to ensure that the oxygen delivery device is set at a rate of 10 to 15 liters per minute in order to maintain the bag's inflation. Patient triage is being performed by the nurse working in the emergency department, ED. It is imperative that the nurse check in with the patient as soon as possible. A. Is now receiving treatment for depression and is seeking the antidepressant that was prescribed to them to be refilled. B. Is undergoing radiation therapy with an external beam for breast cancer and has reported blistering at the location of treatment. C. The individual suffers from abrasions and bruises to the right upper extremities as a result of falling while riding their bicycle. D. Reported experiencing discomfort and swelling in the left testicles along with nausea and vomiting. The correct answer is choice D. A significant cause for concern is the fact that this patient is exhibiting symptoms that are consistent with testicular torsion. Should the condition of testicular torsion not be promptly addressed, it has the potential to render the affected testes non-viable. A scrotal ultrasound should be performed on the patient as soon as possible to confirm these findings, and then surgical surgery should be performed. Option A is incorrect. A customer who comes into the emergency room to ask for a refill on their medicine is considered to be of low priority. The nurse should put the patient's physical need first. Option B is incorrect. A lack of skin integrity is one of the adverse effects that can occur as a result of exposure to external beam radiation. In order to treat the diseased area, a doctor might recommend applying a medicated ointment. This will not be a high priority. Option C is incorrect. Bruising and abrasions are to be anticipated in the aftermath of a bicycle collision. After the client's intervention with testicular torsion, it is highly possible that this customer will be the next one to receive guidance and assistance with therapy. Torsion of the testicles is a medical emergency that, if you do not receive treatment as soon as possible, can lead to the loss of the testes viability. The manifestations typically manifest in a sudden manner and consist of testicular pain that may radiate to the lower abdomen. The diseased testicle is often characterized by a rigid, bloated, and sensitive sensation when touched. It is possible that this condition may be accompanied by nausea and vomiting. An immediate diagnostic examination, specifically a testicular ultrasound, is required to confirm the presence of this emergency situation. As a result of the earthquake, the nurse arrives to provide assistance to the victims. Which of the victims would the nurse consider to be the most urgent of the patients that require emergency medical attention? A. A patient who is 70 years old, has multiple wounds that are bleeding heavily, and is pale and lethargic. B. A 35-year-old individual who appears worried, exhausted, and is breathing through the muscles in their neck. C. She is an 18-year-old girl who is holding her head, expressing confusion and complaining of feeling sick. D. A 66-year-old man who's defending his right leg and ranks his level of pain as a 10 out of 10. The correct answer is option B. For the purpose of prioritizing patients in a disaster or mass casualty situation, triage systems are absolutely necessary. During a disaster, the process of triage involves determining how to distribute limited resources in the ideal manner. When there is a disaster, the person who has injuries that are potentially life-threatening and who has a good chance of survival if they are stabilized is given the greatest priority. During an earthquake, it's not uncommon for patients to arrive with chest damage, including pneumothorax or hemopneumothorax. Option B indicates that the patient is exhibiting symptoms that are strongly suggestive of traumatic pneumothorax. These symptoms include the use of auxiliary muscles in the neck, sternocleidomastoid and scalene muscles, for breathing, as well as anxiety as a result of having difficulties getting enough air. When there is an increase in the amount of work that is required to breathe, accessory muscles provide assistance. As a result, the recruitment of accessory muscles is an indication of respiratory fatigue as well as acute respiratory distress. It is imperative that this patient undergoes quick chest decompression in order to facilitate lung expansion. This patient would be the nurse's first priority. In this particular circumstance, a needle thoracostomy and a later tube thoracostomy might prove to be life-saving procedures. Option A is incorrect. Due to the loss of blood, this individual is most likely experiencing hypovolemic shock. In comparison to the patient who is suspected of having pneumothorax, this individual has a low chance of survival. Consequently, they would not be the most important patient to receive treatment for. Option C is incorrect. This individual exhibits symptoms that are consistent with a concussion, and while there is a good chance that they will survive, the injuries are not as severe or urgent as those that were sustained by the patient who was suspected of having pneumothorax. Option D is incorrect. A minor injury, such as a broken bone, is most likely present in this individual. However, the damage would not require the most immediate attention and could be delayed until the more severely injured are stabilized. The likelihood of survival is high, but the damage would not require immediate attention. The nurse working in the emergency department is providing medical attention to a patient who was involved in a car accident and sustained multiple rib fractures as well as a nasal fracture. Which of the findings from the assessment are in need of immediate follow-up? A. Exhalations that are shallow. B. Pain in the chest even after repositioning. C. Chest wounds that are bruising. D. Vomiting up. Correct answer is choice D. The client in question suffered a nasal fracture as a result of facial trauma, which may have led to brain trauma as a consequence. If you are experiencing vomiting, it is an early sign of increased intracranial pressure that requires immediate medical attention. It is the responsibility of the nurse to inform the attending physician about the change in the patient's condition and to get the patient ready for an immediate computed tomography (CT) scan of the head in order to verify the findings. Maintaining the client's head in a neutral position and elevating the head of the bed to a position between 30 and 45 degrees are two interventions that the nurse should administer. It is possible that this will help bring down some of the rising ICP. There are additional findings that are associated with an elevated intracranial pressure, such as irritability, altered levels of consciousness, and headaches. It is not correct to select options A, B, or C. In the aftermath of any chest trauma, it is common practice to anticipate shallow respirations. A shallow breathing pattern comes about as a result of the pain that the client experiences when they are inspired. This gives the nurse reason to believe that the patient may require pain medication that has been prescribed to them, but that they do not require immediate follow-up. A note of caution: shallow breathing does not necessarily indicate hypoxia. A client may breathe shallowly and still be able to oxygenate their body adequately. The increased carbon dioxide levels that cause the client to experience pain may cause the client to be less likely to take a full exhalation, which can lead to the development of respiratory acidosis. Pneumothorax is a condition that can be caused by rib fractures. However, tachypnea and increased respiratory effort are the classic symptoms that are observed. Because of the rib fractures, it is also normal to experience chest pain when repositioning the patient. There is a significant amount of pain associated with rib fractures, and significant pain triggers include repositioning and coughing. An expected finding associated with rib fractures is the presence of bruising on the sides of the chest. In addition to this, one of the most common causes of rib fractures is chest trauma, which can be caused by a motor vehicle accident or physical assault. Rib fractures are extremely painful. One of the concerns that arises after rib fractures is the possibility of the patient developing pneumothorax, which is characterized by tachypnea, diminished or absent breath sounds, and hypoxia. Anti-inflammatory medications, ice, and incentive spirometry are the recommended treatments for rib fractures. This is due to the increased risk of atelectasis among patients with rib fractures. It has come to the nurse's attention that the following client circumstances have occurred. First, the nurse needs to carefully examine which patient. A patient who is suffering from chronic obstructive pulmonary disease, COPD, who is breathing with their lips pursed and experiencing a productive cough. B, the patient who underwent a laparoscopic cholecystectomy 3 hours ago is experiencing pain in the right shoulder as well as cramping in the abdominal region. C, who is suffering from ulcerative colitis and has reported experiencing abdominal cramping in addition to having 3 bloody stools in the past 2 hours. D, it is 2 hours after the tonsillectomy and the patient is complaining of pain in the throat while vomiting. Correct answer is choice D. There is an immediate need for follow-up care for the patient who has been vomiting after having their tonsils removed. This is because coughing and vomiting can both cause bleeding. A follow-up appointment is required immediately for this patient so that the nurse can administer antiemetics as directed to treat the vomiting and evaluate the patient for the possibility of bleeding. It is not correct to select options A, B, or C. A client with chronic obstructive pulmonary disease, COPD, who is experiencing a productive cough and breathing with their lips pursed is a finding that is expected. Additionally, coughing is a diagnostic sign of a patent airway. There is no immediate need to follow up with this particular client. It is common for a patient recovering from laparoscopic procedures to experience abdominal cramping and shoulder pain as a result of gastric insufflation. Gastric insufflation refers to the process of infusing air or carbon dioxide into the abdominal cavity in order to visualize the abdominal organs. This discomfort is typically alleviated by having the patient walk around. In patients who are experiencing an exacerbation of ulcerative colitis, it is common for them to experience abdominal cramping, in addition to taking multiple bloody stools. This is a finding that was anticipated. In addition to this, when a tonsillectomy is performed, it's important for the nurse to discourage coughing because it can cause the operative side to become stressed, which can result in bleeding. Nausea and vomiting that occur after a tonsillectomy should be treated as soon as possible in order to prevent the operative from experiencing stress, which could potentially result in bleeding. A client who has sustained a closed head injury is receiving mechanical ventilation and is at risk for developing increased intracranial pressure, ICP, is being cared for by a newly hired nurse, who is being observed by the charge nurse. Considering the circumstances, which of the following actions, if carried out by the newly hired nurse, would necessitate immediate intervention? A. At the moment that the high-pressure alarm goes off, the patient is being suctioned. B. Prior to suctioning, hyperventilating with 100% FiO2 was recommended. C. Dental hygiene is performed every 2 hours. D. Ensuring that the head of the client's bed is at an angle greater than 90 degrees. Correct answer is choice D. When considering a client who has suffered a traumatic brain injury, TBI, it is not beneficial to keep the head of the bed at an angle that is greater than 90 degrees. ICP should be avoided by the client by avoiding hip and neck flexion because it raises ICP. The intracranial pressure, ICP, may drop even further if the head end of the bed is elevated to a degree greater than 30 degrees. However, this may also result in an unwelcome drop in the mean arterial pressure, MAP. CPP, or cerebral perfusion pressure, is decreased when there is a decrease in MAP. With a traumatic brain injury, a decrease in CPP is detrimental to the client. The recommendation for the head of the bed for a patient who is at risk for increased intracranial pressure is therefore 30 degrees. This angle brings about a reduction in the intracranial pressure, ICP, while ensuring that the central pulmonary pressure, CPP, remains within the range of 70 to 80 mmHg. In this particular scenario, it is essential to raise the head of the bed in order to prevent the patient from developing pneumonia that is acquired through the use of a ventilator. Option A is incorrect. For patients who have artificial airways, suctioning is an essential procedure that must be performed. An appropriate intervention would be to suction the patient whenever the high-pressure alarm goes off. An alarm with a high pressure is activated whenever there is a clear indication of an obstruction in the tubing. The failure to intervene immediately may result in the compromise of the airway, which puts the patient at risk of passing away. The intracranial pressure, ICP, may rise as a result of suctioning. Option B is incorrect. A temporary reduction in intracranial pressure and a reduction in carbon dioxide levels can be achieved through hyperventilation with 100% fluid oxygen. The use of this intervention is appropriate, particularly when suctioning a patient who is intubated. Option C is incorrect. An example of a routine nursing intervention that helps support client hygiene is the practice of performing oral care every 2 hours. In addition to providing the patient with comfort, it assists in the prevention of complications, such as infection. In addition to this, when the nurse is providing care for a patient who has had a traumatic brain injury, TBI, it is important to ensure that the environment is low stimulating. It is important to remember to position the client so that their neck is in the middle of their body. Alterations in the level of consciousness are the initial indication that a client is experiencing an increase in intracranial pressure, ICP. When the client has an intracardiac pressure, ICP monitoring device, it is imperative to ensure that it is properly zeroed and leveled. ICP readings should be closely monitored, and any discrepancies from the baseline should be reported. As excess intravascular volume can contribute to increased intracranial pressure, ICP, it is important to maintain a strict fluid balance in order to prevent fluid overload. It has been brought to the attention of the nurse that the following client matters have occurred. First, the nurse needs to carefully examine the patient A. with chronic obstructive pulmonary disease, COPD, who has an oxygen saturation of 90%. B. having a blood pressure reading of 151/95 mmHg and complaining of a headache. The patient is currently receiving treatment for hypertension. C. An individual who is experiencing fever and chills and who has a urinary catheter in place. D. With the onset of dyspnea being reported by a chest tube that is attached to a closed chest drainage system within the chest. Correct answer is choice D. Due to the development of dyspnea, this patient needs to be followed up with as soon as possible. There are a number of potential complications that could be causing the dyspnea, including dislodgement or a malfunction in the chest tube drainage system. Should the chest tube become dislodged, it has the potential to exacerbate the patient's condition and result in complications such as a tension pneumothorax. The nurse should always have emergency chest tube supplies at the bedside, including a clamp, occlusive gauze, and a bottle of saline or sterile water. Option A is incorrect. The client has an acceptable oxygen saturation level of 90%, given that the client has COPD. An oxygen saturation of 88% or greater is generally acceptable. Option B is incorrect. The client with a blood pressure of 151/95 mmHg has a high blood pressure reading. However, this client is being treated for hypertension. The headache could be related to elevated blood pressure, but the client is not presenting with acute distress or severe symptoms. Option C is incorrect. The client with an indwelling urinary catheter experiencing fever and chills is concerning for urosepsis. However, the client with a chest tube reporting dyspnea prioritizes this client because of the problem related to the client's respiratory system. The emergency department, or ED nurse, is caring for an infant who is choking on a foreign object. On assessment, the infant is conscious and not making any noises. The nurse should immediately A. Begin chest compressions at 100 to 120 per minute. B. Attempt a blind finger sweep in the mouth. C. Perform abdominal thrusts. D. Give 5 back blows and 5 chest thrusts. Correct answer is choice D. For the infant choking on a foreign body and conscious and not making any noises, the nurse should immediately give 5 back blows and 5 chest thrusts. The nurse should place the baby face down on the forearm to do this. With the arm resting on your thigh and with the heel of your other hand, give the child 5 quick, forceful blows between the shoulder blades. If this is ineffective, the nurse should turn the infant on its back so that the head is lower than the chest. Place 2 fingers in the center middle of the breastbone just below the nipples. Press inward rapidly 5 times. It is not correct to select options A, B, or C. Chest compressions should only be done if the infant loses consciousness and is pulseless. This infant is conscious and unlikely to be pulseless, and doing this step would be unnecessary and delay the immediate treatment, attempting to remove the foreign body. Blindly sweeping the mouth is not recommended because this may push the object further into the airway. Abdominal thrusts should be performed for a child and adult, not infants. For an infant, deliver repeated cycles of 5 back blows or slaps, followed by 5 chest compressions until the object is expelled or the victim becomes unresponsive. Abdominal thrusts are not recommended for infants because they may damage the infant's relatively large and unprotected liver. If the victim becomes unresponsive, start CPR with chest compressions. Do not perform a pulse check. After 30 chest compressions, open the airway. If you see a foreign body, remove it, but do not perform blind finger sweeps because they may push obstructing objects further into the pharynx and may damage the oropharynx. Attempt to give 2 breaths and continue with cycles of chest compressions and ventilations until the object is expelled. After 2 minutes, if no one has already done so, activate the emergency response system. The charge nurse of a medical surgical unit is informed that the nursing unit is short-staffed. Which task should the charge nurse delay in order to meet all client needs? A. Medication administration. B. Daily baths. C. Vital sign collection. D. Safety. The correct answer is option B. When the nursing unit is short-staffed, non-essential tasks may be delayed. Daily baths are a non-essential task compared to medication administration, vital sign collection, and hourly safety rounds. It is not correct to select options A, C, or D. Medication administration cannot be delayed because of staffing issues. This would result in the deterioration of client care. Vital sign collection is essential to determine a client's stability. Additionally, vital signs are often necessary to perform a safe medication administration. For example, the need to have a recent blood pressure before giving an antihypertensive. Safety cannot be compromised because of short staffing. The safety rounds must be completed. The nurse is triaging phone calls in the prenatal clinic. The nurse should initially follow up on the client who is A. 18 weeks of gestation and reports a fluttering sensation. B. 22 weeks of gestation and reports perianal itching and bright red blood in the stool. C. 26 weeks of gestation and reports intermittent leg cramping with swelling in her feet. D. 38 weeks of gestation and reports lower back pain that increases with walking. Correct answer is choice D. These manifestations indicate that the client may be beginning labor. True labor manifestations include contraction patterns of increasing frequency, duration, and intensity. The contractions tend to increase with walking and may start in the lower back and gradually sweep around to the lower abdomen. Considering the client's gestational age and manifestations, this client requires immediate follow-up. Option A is incorrect. The fluttering sensation is quickening when the client first experiences the sensation of the baby. Quickening tends to occur between 16 to 20 gestational weeks. This is an expected finding that does not require follow-up. Option B is incorrect. Perianal itching and bright red blood in the stool are manifestations of hemorrhoids. Hemorrhoids are common in pregnancy, especially in the third trimester, because of increased venous congestion and pregnancy-related constipation. Option C is incorrect. Intermittent leg cramping and foot swelling are common in pregnancy, especially at night. Having the client elevate her feet and have a magnesium, sodium, and calcium-rich diet may alleviate the cramping. At-home exercises may be helpful, such as instructing the client to stand and apply pressure on the affected leg with the knee straight. In addition to this, the client with hemorrhoids should be taught measures to alleviate constipation through increased fluid intake and eating a high-fiber diet. Tepid baths and topical witch hazel may be provided to relieve the pain. The client should be instructed to lie on their side with hips elevated on a pillow to alleviate pressure on the hemorrhoids. The nurse is caring for assigned clients. In the beginning, the nurse should A. Evaluate a client's manto-tuberculin skin, TB, for reactivity 48 hours after it has been administered. B. Assess a client with atrial fibrillation who has an irregular pulse, P, of 90 beats per minute. C. Apply the prescribed lidocaine patch to the lumbar back region of a client with chronic back pain. D. Administer prescribed ciprofloxacin scheduled for a client with peritonitis. Correct answer is choice D. Peritonitis is a life-threatening infection that has a high mortality rate if it is not treated early and aggressively. It is appropriate for the nurse to prioritize this client because of their acute status. Finally, scheduled antibiotics must be administered on time so the client maintains a therapeutic blood level of the medication. Option A is incorrect. The nurse has 48 to 72 hours to determine the reactivity of a manto-tuberculin skin test. This type of testing for pulmonary tuberculosis is not the most accurate. Sputum culture is the most accurate and has a window time to be read. This should not be prioritized over the acute need to administer a scheduled antibiotic. Option B is incorrect. Atrial fibrillation causes an individual to have an irregular pulse. This client's situation is stable as long as the rate is maintained between 60 and 100 beats per minute. Option C is incorrect. Chronic back pain would not be prioritized over the client with peritonitis, which is an acute, life-threatening infection that requires aggressive medical and possible surgical management. The nurse is reviewing the plan of care for a client admitted to the behavioral health unit with anorexia nervosa. The nurse understands that the priority goal for this client is A. Attending scheduled group therapy. B. Adhere to the medication regimen. C. Gain 1 pound or half a kilo a week. D. Demonstrate increased self-esteem. Correct answer is choice C. Physical needs always prioritize over other needs. For the client with anorexia nervosa, the priority is to stabilize and increase the client's weight. Anorexia nervosa may lead to life-threatening electrolyte disturbances if it goes untreated. It is not correct to select options A, B, or D. Group therapy helps treat anorexia nervosa, but having the client attend is not essential compared to weight gain. Medication plays little role in treating anorexia because no approved medication is available directly for anorexia. However, medications may be used off-label, such as mirtazapine, to treat depressive symptoms and to promote weight gain. A decrease in self-esteem is common with anorexia nervosa. Still, it does not prioritize the client's physical needs, which is dangerously low weight, as the diagnostic criteria for anorexia nervosa are body mass index of less than 18.5 kilograms per m2. The nurse is assessing a client who reports intermittent tingling and numbness in bilateral lower extremities. Which intervention by the nurse would be most important to prevent injury for this client? A. Perform Weinstein monofilament test. B. Refer the client for a diabetic diet consult. C. Obtain an order for gabapentin. D. Teach the client about appropriate footwear. Correct answer is choice D. Peripheral neuropathy puts the client at increased risk for traumatic injury and tissue breakdown, since the client may not notice early skin damage due to altered sensation. Of the options provided, educating the client on proper footwear is the only action that aims to prevent injury related to the client's altered sensation in the feet. Option A is incorrect. The Weinstein monofilament test is an appropriate way to test for sensation in the feet and is used to identify risk for neuropathic ulceration, but this assessment tool is not a preventative action. Option B is incorrect. Diabetes is a common cause of peripheral neuropathy, but the question does not provide any information that indicates this client is diabetic and would not specifically address promoting the client's safety. Option C is incorrect. Gabapentin is used to improve neuropathic pain and may be appropriate for this client, but would not directly prevent injury. The nurse is caring for a client who intentionally overdosed on amitriptyline. What action should the nurse prioritize? A. 12-lead electrocardiogram should be obtained. B. Request a prescription to consult psychiatry. C. Determine the reasoning for the overdose. D. Establish a therapeutic relationship. The correct answer is option A. Amitriptyline is a tricyclic antidepressant, TCA, and when taken in excess may cause cardiac dysrhythmias. TCA toxicity's most severe cardiac effects include QT interval prolongation, torsade de pointes, and sudden cardiac death. The essential action is to address the patient's physiological needs by assessing if the patient has catastrophic dysrhythmias. It is not correct to select options B, C, or D. Consultation with psychiatry is highly likely considering the intentionality of the overdose. However, the priority is the patient's physiological needs. Determining the reasoning for the overdose and establishing a therapeutic relationship is not a priority over the patient's physical needs. In addition to this, TCAs are indicated for depressive and oppressive disorders. Considering they are profoundly anticholinergic, the toxicity of these medications may be fatal. Drugs in this class include amitriptyline, nortriptyline, and imipramine. Clinical features of an overdose include dysrhythmias, hypotension, confusion, and hyperthermia. The nurse should immediately determine hemodynamic stability through continuous cardiac and blood pressure monitoring. The nurse is caring for a child immediately following a nephrectomy in the post-anesthesia care unit, PACU. Which assessment should the nurse initially perform? A. Pain level. B. Peripheral vascular access device. C. Surgical incision. D. Vital signs. Correct answer is choice D. Immediately following surgery, the nurse needs to determine the client's physical stability by obtaining and assessing vital signs. General anesthesia may cause a client to experience respiratory depression, and the only way this may be determined is through the vital signs, respiratory rate, and pulse oximetry. The client's pulse will also need to be ascertained because if it's tachycardia, it may indicate shock. Option A is incorrect. Assessing the client's pain level is part of the post-operative assessment, but it would not be as valuable as the client's vital signs. The client's pain level would not yield any information if the client would be experiencing respiratory depression, shock, or hypothermia. Option B is incorrect. Assessing the PVAD is part of a nursing assessment, but would not prioritize the client's vital signs, which are clinically significant within the immediate post-operative period. Option C is incorrect. Assessing the surgical incision is not a priority compared to determining the client's overall physical status. Vital signs during the immediate postoperative period are highly valuable because they may indicate if the client is experiencing hypothermia, respiratory distress, or shock. The nurse is caring for a client taking prescribed captopril. What abnormal laboratory values should the nurse prioritize when notifying the healthcare provider? A. Serum creatinine 1.3 mg per dl. B. Serum potassium 5.2 MEq per L. C. Serum phosphorus 4.6. D. Blood glucose 135 mg per dl. The correct answer is option B. The nurse should prioritize notifying the healthcare provider about the serum potassium level. Captopril, an ACE inhibitor, can cause hyperkalemia. Hyperkalemia can lead to cardiac arrhythmias and other serious complications. Option A is incorrect. A serum creatinine level of 1.3 mg per dl is slightly elevated, but not a critical value requiring immediate notification over the potassium level. Option C is incorrect. A serum phosphorus level of 4.6 MEq per L is slightly elevated but not a critical value that requires immediate notification. Option D is incorrect. A 135 mg per dl blood glucose level is slightly elevated but not significantly high. It's not an urgent concern that requires immediate notification to the healthcare provider. In addition to this, the ACE inhibitors are a large group of antihypertensive drugs. Currently, there are 10 ACE inhibitors available for clinical use. Hyperkalemia from ACE inhibitors directly results from its mechanism of action. The blockade of angiotensin II prevents the downstream secretion of aldosterone. Aldosterone causes reabsorption of sodium and, subsequently, water. Consequently, protons and potassium get secreted into the urine. Without potassium secretion through aldosterone, potassium can easily increase in clients on ACE inhibitors. Potassium plays a crucial role in maintaining the heart's electrical activity. When potassium levels are too high, it can disrupt the normal electrical signals in the heart, leading to cardiac arrhythmias. Angioedema is the most serious adverse effect associated with ACE inhibitors, as it may cause airway obstruction. The nurse is caring for signed clients. The nurse should immediately follow up on the client who A. Who is being treated for pneumonia and develops restlessness. B. The patient who is receiving intravenous fluids for influenza and dehydration and reports a headache. C. The patient who has a chest drainage system in place for a hemothorax and titling is present in the water-sealed chamber. D. The patient who is being treated for pleurisy and is experiencing inspiratory chest pressure. The correct answer is option A. Restlessness is a concerning finding as it may indicate the client is experiencing shock or hypoxia. The nurse needs to act and perform vital signs to determine the etiology of restlessness. If the restlessness is due to hypoxia, supplemental oxygen should be provided. The most significant complication with pneumonia is the client developing acute respiratory distress syndrome, which may require mechanical ventilation. It is not correct to select options B, C, or D. Headache is a common finding for both dehydration and influenza. Considering this is an expected finding, the nurse should not prioritize this client over the client experiencing restlessness. Titling and intermittent bubbling in the water-sealed chamber of the chest drainage system are expected. It is continuous bubbling in this chamber which indicates an air leak. Pleurisy is a condition that causes inflammation of the pleural cavity, and a classic sign is coughing, which induces chest pain and chest pain with inspiration. Treatment may be prescribed antibiotics and anti-inflammatories. The nurse is caring for a client with a percutaneous endoscopic gastrostomy tube. Prior to administering the next feeding tube, the nurse aspirates 70 ml of gastric residual. The nurse should then A. Notify the physician. B. Hold the tube feeding and recheck residual volume in 1 hour. C. Administer the prescribed feeding. D. Reposition the patient in low Fowler's position. Correct answer is choice C. According to the current American Society of Parenteral and Enteral Nutrition Guidelines for Nutrition Support, enteral nutrition should not be stopped for a gastric residual volume (GRV) of less than 500 ml unless there are other signs of feeding intolerance. Symptoms of feeding intolerance include nausea, vomiting, abdominal distension, constipation, and abdominal pain. If no bowel sounds are present, the nurse should assess the client's abdomen for changes from the baseline, such as tenderness or distension. If there are no changes from the baseline, the feeding bolus may be administered as ordered. Option A is incorrect. In the absence of signs of feeding intolerance, the feeding can be continued as long as the GRV is less than 500 ml. However, the provider should implement methods to reduce aspiration risk for the GRVs ranging from 200 to 500 ml. Such measures include administering prokinetic agents such as metoclopramide and erythromycin to stimulate gastric motility. Optimizing glucose control, hyperglycemia can delay gastric emptying, and using continuous rather than bolus feeding for high-risk clients. Option B is incorrect. The client's gastric residual is within normal limits, and the nurse does not need to alter the feeding schedule. Option D is incorrect. Prior to administering bolus feedings, the client should be positioned with the head of the bed elevated to administer the prescribed feedings. Administering the feedings while the client is in a low Fowler's position would increase the risk for the client aspirating on the tube feeding. The nurse administers intravenous levofloxacin instead of the prescribed azithromycin. What is the first step that the nurse ought to take among the following actions? A. Stop the infusion. B. Complete an incident report. C. Obtain vital signs. D. Notify the main healthcare provider, PHCP. The correct answer is option A. The nurse should promptly cease the infusion. The nurse identified a drug error, and pausing the infusion is crucial. Option B is incorrect. The nurse should complete an incident report. However, this is not a priority compared to halting the infusion. The incident report will be done once the infusion has ended, the physician is alerted, and, if necessary, appropriate actions are implemented. Option C is incorrect. Obtaining vital signs is necessary, but should not be prioritized over halting the infusion. Obtaining vital signs is crucial to assess if any adverse responses have occurred, but discontinuing the infusion is essential. Option D is incorrect. Before contacting the physician, the nurse should execute an immediate action, such as discontinuing the present infusion. Prior to contacting the physician, the nurse should gather vital signs to assess if any reaction has occurred. Clients who have been allocated to the nurse are being cared for by the nurse. The nurse should immediately follow up with the client who A. Is repeatedly washing their hands. B. Talking over other people while they are participating in group therapy. C. Loudly yelling and shouting at other people. D. Is voluntarily admitted and seeks dismissal from the facility. Correct answer is choice C. Immediate involvement is required because the client is yelling and shouting at other clients, which is a hostile setting that requires the nurse to de-escalate the situation before it becomes more intense. It is not correct to select options A, B, or D. The presence of obsessive-compulsive disorder is characterized by the client's habit of washing their hands over and over again. The nurse should refrain from intervening in this behavior unless the client or others are in danger. In addition, if a client is talking over other people in therapy, it will be necessary to intervene. However, such action is not an instant necessity because the scenario is not hostile. Last but not least, clients who have willingly been admitted to the facility may submit a request for discharge. Nevertheless, this is a low priority matter in comparison to the client's behavior of yelling at other people. 4 separate incidences have been brought to the attention of the community health nurse. Which circumstance calls for a follow-up to be taken immediately? If a client has A. Although having received therapy for 2 months, the patient continues to test positive for pulmonary tuberculosis, TB. B. Hepatitis A, who works as a cook at a local hospital center. C. Individual infected with human immunodeficiency virus, HIV, who has an undetectable viral load, VL, and who has recently engaged in sexual activity without providing protection. D. Is experiencing nausea and vomiting as a result of Lyme's disease, and she is refusing to continue her treatment with intravenous antibiotics. The correct answer is option B. It is recommended that a customer who is infected with the hepatitis A virus be excused from working and prohibited from handling food until they have received effective treatment. Due to the fact that this client does not engage in behaviors that promote proper hand hygiene, there is a significant probability that the virus will be transmitted to others through the consumption of contaminated food. Therefore, it is imperative that the nurse take action in order to prevent an outbreak of hepatitis A, particularly within a healthcare facility. Option A is incorrect. When a patient is diagnosed with pulmonary tuberculosis, they will be required to receive anti-tuberculin medication for a period of 6 to 9 months. Additionally, in order to confirm that the client has latent tuberculosis, the client will be required to have 3 consecutive negative TB tests, also known as sputum. Option C is incorrect. A client who is HIV positive and has a VL that is undetectable for an extended period of time has little probability of transmitting the virus to others. When compared to the worker who is infected with HAV, who has the potential to infect dozens of others at the healthcare facility, the nurse's advocacy for protected sexual encounters is not as significant. This is because protected sexual encounters can prevent the transmission of other sexually transmitted viruses. Option D is incorrect. Drugs like doxycycline, which are antibiotics, have proven to be effective in treating Lyme disease. Humans do not pass Lyme disease on to one another. Rather, ticks are the carriers of the disease. It is not necessary to give this client scenario a high priority, because the client does not pose any danger of passing on the virus to other children or adults. The nurse must promptly address the following client circumstances. It is incumbent upon the nurse to immediately follow up with the patient who is involved. A. With feeling nervous when receiving albuterol using a nebulizer and reporting feeling anxious. B. After undergoing complete hip arthroplasty, is currently waiting for a referral to home health care. C. The individual is 6 hours after undergoing a hysterectomy and is experiencing nausea. D. Following having a cast applied for a fracture 3 hours earlier, the individual is claiming that their arm is sleeping. The correct answer is choice D. It is imperative that prompt follow-up be performed on the patient who has reported that their extremity is sleeping after the cast was on. This gives rise to the possibility of compartment syndrome, and the nurse must take action in order to prevent the patient from losing the extremity. In the early stages of compartment syndrome, symptoms such as paresthesia, numbness, and pain that is not alleviated by opioid therapies are observed. It is not correct to select options A, B, or C. The presence of nervousness during an albuterol breathing therapy is a finding that is to be anticipated. During a treatment, the client may have feelings of nervousness or jitterness because albuterol is a bronchodilator that has a brief duration of action and causes stimulation of the central nervous system. At this time, there is no urgent case for concern for the client who is waiting for a referral to get home health care because there is no danger to their overall physical stability. After surgery, nausea is a frequent complaint that patients get. It is important for the nurse to follow up with this patient, but they should not make this a priority because the patient's extremity is experiencing poor perfusion. The nurse working in the emergency department, ED, is providing care to a patient who is brought in after being discovered wandering about a neighborhood without shoes, confused and unaware of their surroundings. In the beginning, the nurse should A. Find out the vital signs. B. Carry out a mental status examination. C. You should make an effort to find the client's family. D. You should submit a request for a psychiatric consultation order. The correct answer is option A. Priority must be given by the nurse to the client's physical requirements. It is therefore necessary for the nurse to first evaluate the client's vital signs in order to ascertain the client's level of stability. Option B is incorrect. As part of the assessment, the nurse will conduct a mental state examination on the patient. In spite of this, it does not place a high priority on acquiring and evaluating the client's vital signs, which are critical to the client's overall physical state. There is no need to rush through this evaluation until the client's physical stability has been evaluated. Option C is incorrect. Due to the fact that doing so diverts the nurse's focus away from the client's physical requirements, the nurse should not make any attempt to seek the client's family in order to provide complementary medical information. Even though this could be an important chore, the first thing that needs to be done is to determine the client's physical stability by gathering and analyzing their vital signs. Option D is incorrect. If this is the case, it may be necessary to meet with a psychiatrist in order to ascertain the cause of the client's unusual behavior and perplexity, as well as to discuss various treatments for the condition. Nevertheless, collection and evaluation of vital signs are necessary in order to determine the client's level of physical stability. The nurse is providing medical attention to a young child who is now having a tetralogy of phalate (TET) spell. Which one of the following is the most important action for the nurse to take? A. Take propranolol as directed. B. Sodium bicarbonate should be administered. C. Put the baby at ease. D. Let the healthcare practitioner know about it. Correct answer is choice C. When an infant is experiencing a TET spell, the nursing priority is to immediately soothe the infant down. The pulmonary vascular resistance of the newborn is increasing when they are crying, which results in a decrease in the amount of oxygenated blood and an increase in cyanosis. If you're able to calm them down, you will immediately be able to reduce their pulmonary vascular resistance, which will allow blood to flow to the lungs and supply oxygen to the body. It is imperative that the nurse acts in this manner as the initial step. Option A is incorrect. Propranolol may be administered to infants who have tetralogy of phalate. Nevertheless, it will not be the nursing action of choice for a newborn who is undergoing a TET spell. It is going to be given much later, if it is required. Option B is incorrect. In the event that a TET spell does not resolve, sodium bicarbonate might be required at some point over the course of the infection. However, it would not be advised as soon as the TET spell begins, nor would it be the nursing action of priority. Option D is incorrect. However, despite the fact that the nurse will be required to inform the healthcare provider about the spell and may require additional support, this is not the most important measure to do. Among the actions that are specified, there is one more that will provide immediate assistance to the newborn and ought to be the priority. Prescribed meds have been given to the patients who have been allocated to the nurse. What kind of follow-up evaluation calls for immediate follow-up assistance? An individual who is given a prescription. A. Injectable hydromorphone is a sleepy medication that is used to treat persistent back pain. B. The patient is currently experiencing involuntary movements of the jaw and is receiving intravenous metoclopramide for nausea and vomiting. C. In patients with chronic bronchitis who are experiencing perineal itching, intravenous dexamethasone was administered. D. Nitroglycerin infusion for chest pain and expresses concern about having a headache. The correct answer is option B. Due to the fact that dystonic movements of the face constitute a serious adverse reaction to metoclopramide, this client has reported that they will pursue further treatment. As a dopaminergic medication, metoclopramide is associated with an increased risk of extrapyramidal syndrome. In order to prevent the patient from experiencing this side effect, the nurse should administer this medication in conjunction with the prescribed diphenhydramine and dilute the metoclopramide before providing it by parenteral route. Option A is incorrect. When taking opioids like hydromorphone, it is normal to experience drowsiness. That which gives cause for concern is the sedation. When the patient is in a condition of drowsiness, they are able to easily awaken, whereas when they are under sedation, they require more unpleasant stimuli to be awakened. Because it occurs just before respiratory depression, sedation is a very important condition to recognize. Option C is incorrect. The use of intravenous dexamethasone for the treatment of chronic bronchitis is associated with the potential for the patient to have perineal itching, which is a non-life-threatening symptom. In order to prevent this from happening, the medication should be diluted and then gently infused into the body. A steroid such as dexamethasone is utilized in the treatment of inflammatory disorders. Option D is incorrect. Nitroglycerin administered intravenously is a vasodilator that is used in situations where a headache is anticipated. Because this is a discovery that was anticipated, this customer does not require any more investigation. In addition to this, in the treatment of nausea and vomiting, metoclopramide, which is a dopaminergic drug, is used. It is possible for dystonia to occur if the medication is administered intravenously. The nurse should administer the drug in a diluted form and in conjunction with an antihistamine that has been recommended, such as diphenhydramine, in order to avoid this. If the patient is experiencing diarrhea, the nurse should refrain from administering metoclopramide because this medication is a stomach emptier and has the potential to exacerbate the condition. Clients who have been allocated to the nurse are being cared for by the nurse. In the first place, the nurse ought to follow up with which patient? As a customer who has A. Both the low pressure alert and the mechanical ventilation system are audible. B. A new colostomy and refuses to join in the treatment that is provided. C. Has periorbital edema and is suffering from acute glomerulonephritis. D. An erratic pulse and atrial fibrillation are both symptoms. The correct answer is option A. It is necessary to do multiple assessments on a patient who is getting mechanical breathing. In the event that the ventilator is disconnected or the cuff pressure is low, the low pressure alarm is cause for concern. When there is an obstruction, such as secretions, the high pressure alert is considered to be worrying. In accordance with the ABC's priority concept, which stands for airway, breathing, and circulation, this patient ought to be evaluated first. It is not correct to select options B, C, or D. During the process of adjusting to the new body image, a client who has recently received a colostomy may be indifferent to the care that they provide for themselves. Additionally, a patient who is suffering from acute glomerulonephritis may display symptoms of periorbital edema, as well as high blood pressure. In conclusion, atrial fibrillation is a condition that is consistent with an erratic pulse. The nurse is providing care for a patient who is getting intermittent enteral feedings by means of a jejunostomy tube treatment. Which of the following interventions might lower the probability of aspiration for this client? A. After feeding has been finished, flush the tubing with 10 milliliters of water. B. Check the client's gag reaction before beginning the feeding process. C. Regularly check the glucose levels in the blood. D. After the meal, the customer should be placed in a semi-Fowler's position. Correct answer is choice D. It is recommended that the nurse provide assistance to this patient in assuming a semi-Fowler's position for a period of 30 minutes to 1 hour after meals in order to prevent aspiration. Option A is incorrect. Therefore, the client's risk of aspiration would not be reduced by taking this measure. For the purpose of flushing the leftover formula, maintaining patency, and reducing the danger of bacterial development from any formula that may still be present in the tubing, the nurse should use 30 milliliters of tap water at room temperature. Option B is incorrect. It is important to ensure that the patient has a strong gag reflex in order to prevent the patient from aspiring when oral food or water are being administered. On the other hand, this is not acceptable because the patient needs to be fed through a jejunostomy tube, which eliminates the need for oral administration. Option C is incorrect. The nurse should check and record the patient's blood glucose levels every 6 hours throughout the beginning of continuous feedings. This should continue until the levels are kept within the prescribed range for a period of 24 hours at the highest possible flow rate. This client, on the other hand, is having intermittent feedings, and this measure would not lessen the client's risk of aspiration. Additional information. When providing care for a patient who is receiving enteral feedings by a jejunostomy, gastrostomy, or NG, the nurse should be sure to maintain the head of the bed at a temperature between 30 and 45 degrees throughout the feeding process, as well as up to 1 hour afterward. It's important to evaluate the sounds of breathing and note any sounds that are not expected, such as crackling in the lung fields. Kindly report any symptoms or signs of pneumonia, including fever, cough, or any changes in mental status.